So much, everybody. Recording in progress. Thank you so much, everybody, for joining us today. Before we start, I want to give a big thank you to Health Canada and Polera, without whom this wouldn't be possible. So huge thank you. And for those of you who don't know, as Michael mentioned, we've been running this national poll for over a year now. This is our 7th webinar but our 10th poll at the moment, and from which we have over 30,000 data points, I believe. The data from this initiative is freely available to stakeholders, and it is continuously growing. So if anybody would like more information on accessing this data after this webinar, I'm going to put my email into the chat, and anybody can feel free to contact me for more information. Second, there we are. All right. So this survey was taken between December 13th and 22nd, and we did have an upsample from 2 provinces this time, PEI and Nova Scotia. So pretty great Atlantic Canadian sample for this go around. And we did have just over 3,700 people and a margin of error of 1.6%. So this poll came at a really interesting time. It came at the beginning of Omicron, which at the time we knew very little about. And it also came at a time when 5 to 11-year-olds were eligible to get the first vaccine. So we were really excited to get the results of this. And as you might be able to tell, these results didn't end up being exactly what we expected, but I will get to that in a couple of minutes. First of all, I'm going to start with the major findings. So for this poll, we ended up adding a few new questions, one of which was that we wanted to know, in a research context, what Canadians who were impacted by mental health challenges, whether through their own diagnosis or those of loved ones, what they felt that the focus should be on mental health research in Canada. And what we found was that people really were interested in more research on improving mental health service provision. This was followed, we had 3 major focuses here. And the third one, we will get to a little bit further down, but the second was building support around individuals impacted by mental health challenges. The second question that we wanted to look at was less of a research focus and more of a priority focus, I suppose. And the major priority that people thought that should be in the spotlight was ending stigma around mental health challenges. And secondly, they felt that focus should be on the impact of COVID-19 on Canadians and their mental health.
Brittany, can I jump in here for a second?
Yeah, sure.
One thing that's fascinating is we looked at people with diagnosis and we looked at caregivers or people who had someone in their family with a diagnosis. What was fascinating for us was that there wasn't a significant difference between those who are caregivers and those who are have diagnosis themselves. They did prioritize stigma and COVID-19 mental health challenges as the first 2 priorities in both of those groups, with mental health, suicide ideation or reducing suicide, reducing children or improving mental health services for children and youth were also very high up that list, which was certainly fascinating as we just finished Bell at Stock Day. And of course, that has a heavy stigma focus. And so it was interesting to discover that a lot of individuals with diagnosis still consider that to be a major issue. So
we should also mention, as you can see here, that we did list, give an option for 13 potential areas. And it was nice to see because one of those areas was other. Very few people did choose that option. So the 2 that we have listed here did seem to be a very big priority for many Canadians. So as I mentioned, this poll went into market just after children between 5 and 11 became eligible for their first, sorry, brain fog, I need more coffee, for their first vaccine shot. And we were really curious to see the impact that this would have on parents, because we know that when vaccines first became available, it did have a big improvement on the mental health of a lot of Canadians, gave a lot of hope. So we did see, surprisingly, that nearly half of parents say that it didn't have much of an impact on their mental health at all.
Interesting for me as well, just the demographics of the people. Well, the only differences we found in vaccinated parents or parents of vaccinated children were that the older parents who were above 34, 35 had a statistically significant larger number of them have vaccinated their children, which isn't really pertinent to mental health, but was a fascinating finding.
That was interesting.
Data nerds.
As with every poll that we do, we did look at the overall levels of self-reported high anxiety and high depression. And we were interested to find out that with the rise of Omicron, self-reported levels of anxiety didn't change a whole lot. And self-reported high levels of depression haven't moved much outside or since poll 4, sorry, which was in December of last year. So it was really interesting to see with all the unknowns around this new variant that was coming in. So we'll hear a little bit more about that on the next.
Is there any thoughts as to why that might be?
I know we try not to editorialize too much, but I think, in my opinion, largely there was a lot of talk going around that Omicron might be a less severe variant, and that this might actually be the end of COVID or the beginning of the end of COVID. And that's still up in the air. We're still not sure, but at the time, I think that a lot of people's mental health might have actually been, maybe not their mental health improving, but getting a little bit more hope in the area of kind of seeing a light at the end of the tunnel.
I think it's worth noting December 22nd, we had high case counts, but at the point we were still talking about schools remaining open, no lockdowns, et cetera, et cetera. And so there might be a interesting dynamic between people's expectations of what it was going to be and what it turned out to be. At the time, doesn't seem like there was actually a significant increase in anxiety right up until Christmas started, which I thought was certainly something that was interesting.
Mm-hmm. And something we spoke of a lot before these results came was that would affect the possibility of lockdowns we would have on Canadians, because we have found in previous polls, and this one as well, that that social isolation has been one of the major factors contributing to negative mental health in Canadians. So the fear of lockdowns, I myself expected to have a much more significant impact on anxiety levels.
When we do the provincial breakdowns in the past, we have noted that in areas where there have been significant case counts, but lockdowns haven't started yet, we don't see a significant move. And then when you look at a similar province that had just started a lockdown, the anxiety and depression levels were significantly higher. So I think that, and the only time we've ever seen a variance from that is when case counts were very, very high in Alberta. And we hadn't heard from the premier in Alberta for a long time. And so that was we have 5 or 6 examples of it where case counts have been high, but lockdowns haven't existed. Mental health indicators didn't go up. When those mental health indicators did go up was when lockdowns were implemented. We have one experience looking at the data where it is where indeed just case counts themselves have been a driving factor.
Mm-hmm. A couple other questions that we include in this survey are around your fear of COVID or catching COVID. And we were interested to find out that really didn't move at all. Nor did the fear of or the concern around the Omicron variant itself. What we did kind of take note of was that the percentage of people who were concerned about the Omicron variant or catching COVID was the same people who were just concerned about COVID generally. So we didn't find that the fear of COVID or the concern about COVID rose significantly. It's the same people who are afraid of COVID generally who are afraid of the Omicron variant.
And it was impacting their mental health.
Yes. So beyond that, we do a couple mental health symptom scales, one of which is the Kessler-10 scale of psychological distress. So this was a major finding for us this time due to the very high percentage of Canadians that we found experiencing symptoms of severe mental disorder. So it is important to note for these scales, they aren't diagnostic tests, but they do look at the symptoms that Canadians are experiencing. And 44% of Canadians were indicating experiencing symptoms of a severe mental disorder. And another huge finding here is that half of all healthcare workers were likely to be classified as experiencing severe symptoms using this scale. And this indicates a pretty major mental health crisis, which we've heard a lot about over the past year, particularly among frontline workers. Is there anything that you want to add here, Michael?
Yeah. So we run the Kessler Psychological Distress Scale on the entire sample. The 44% represents the number of people who believe they have some degree of psychological distress. They're rating themselves higher, 8 to 10 on a self-rated scale of anxiety and depression. Of that group, 44% were also indicating. So it's a combination statistic, which indicates that of the people who think that they're struggling, they're also having symptoms. So just under half of individuals who believe that they are struggling with anxiety or depression are also exhibiting symptoms of severe psychological distress. So it's just wanted to be clear that, you know, of the 100% of the sample, only about 28% of the sample believes that they are having some degree of psychological, or they believe they have anxiety or depression at a high level. So it's not the full sample. I just want to be clear on that.
And the final of our major findings, which isn't to say there aren't major findings in this data, these are just the things that we found particularly interesting when we were going through. We have so many different demographics and so many different questions that you can mix and match these 1,000 different ways. But the final one that we found interesting was the impact of the economic downturn. It has continuously throughout our polling had a negative effect on Canadians' mental health. And it did only move slightly between polls 9 and polls 10, though it has increased a little bit, 4% from 38% to 42%. But what was interesting to me was that a larger percent of unvaccinated Canadians have concerns about potential job loss, which based on current events wasn't surprising. But 46% of those who are unvaccinated have a fear of losing a potential job loss compared to 36% overall. So we'll move now into our key findings, but before I do, I'd like to take a minute to see if anybody has any questions yet, because this is a lot of information that we're going to be throwing at you.
It might be helpful just because I think I'm looking at the names of the people, and there's at least half of this group are new to this. Just to give a bit of context on the entire project. So, you know, we've been collecting data since April 2020. As Brittany indicated, this is our 10th poll. You know, generally what we start with is a self-rated scale of 1 to 10, simple scale, understanding people's anxiety and depression. And then we also move and look at things like Kessler Psychological Distress Scale. We look at things like the General Anxiety Disorder Scale, which is a psychological screener, GAD-7, and the PHQ-9, which is a screener for depression, which are clinically used tools. And what we look at primarily is also a host of demographics. So we have LGBTQ, non-binary genders, male, female. We have every employment sector we can possibly think of. So what this report represents is a snapshot in time of what we're capturing of some interesting data points that we pulled out of it. But the entirety of the data set is now so large, we're able to really look at some microcosms. We can look rural, urban. We can look at specific postal codes. There's been some analysis that's been done on this, looking at postal codes with high tree coverage and how that influences mental health, because we do have postal code data in here. There's a lot of information in here. And what we're going to cover today is a snapshot of some of the information we have. But really what we're inviting is, if people have specific questions, there's a reasonable chance we've probably analyzed it. We've probably pulled out a research brief. We've probably reported to someone on this. So just reach out to Brittany or myself if you have questions, because we're never going to be able to cover the hundreds of analysis we've done in a short webinar. But I just wanted to put that out there. That's all.
Thank you. And it looks like we are good to go ahead. Some of this is going to be a little bit of a duplicate of the major findings, so I am just going to skim through these key findings just a little bit. As mentioned, we do a number of scales, including the Kessler-10, and we do the General Anxiety Disorder Scale as well as a PHQ-9, which is for levels of depression. So these scales haven't changed, despite the Kessler-10 being a little bit augmented this poll. But one of the questions that we do ask is whether or not Canadians feel that they are handling their feelings of stress, anxiety, and depression well. And since we started doing these surveys, it hasn't been great. Canadians have been having a hard time handling their feelings of stress, anxiety, and depression. And this has continued to increase just a little bit this poll from 19 to 21%, but not too far out of the margin of error. We also look at the Sheehan scale of disability to determine how Canadians are feeling that their mental health is impacting their day-to-day life, including their social life, their family life, and their work life. We found that one quarter of Canadians are continuing to feel the negative effect of their mental health on their ability to function. We started asking about suicide ideation, and I believe, Michael, correct me if I'm wrong, but I believe it was poll 6. And throughout the last few polls, the mental health and suicide ideation among younger Canadians has been of particular concern, particularly when we started to look at 16 and 17-year-olds. And that continues to be a major area that we want to pay attention to, because within the last 3 months, 22% of Canadians aged 16 and 17 have experienced suicide ideation.
I think LGBTQ was another one that was staggeringly high and startling for us.
Absolutely. And we also looked at frontline healthcare workers, which was another area of significant concern.
So for anyone who's curious, by the way, this report is online. We're going through it here. It's quite long. All of this is detailed on further slides. Yes, absolutely. And I will post that in the comments before the end of this webinar, in case anybody would like to take a second look. So as mentioned, we came at this at an interesting time when children were first able to, or 5 to 11-year-olds, were first able to get their first dose of the vaccine. At this point, 9 in 10 eligible Canadians had already received 2 doses of the vaccine, and 15% have received the booster. Again, not a mental health statistic, just an area of interest. And as mentioned before, half of parents say that their 5 to 11-year-old children have received at least 1 dose. 16% were at this point saying that their child would receive it as soon as possible. In previous polls, we found that vaccine status did have an impact on mental health in certain areas. We were interested to find out this time that that gap has closed to a point that it's not really statistically significant between vaccinated and unvaccinated Canadians. We did find, though, that vaccinated and unvaccinated Canadians have different concerns. So while vaccinated people are indicating more fear about the virus and if Omicron, unvaccinated people, those not mentioned here, did have more concern about things like social isolation. We also included, can't remember if we included this in poll 9, but we did have a question about vaccine mandates. I believe poll 9 was the first time that we asked about this. And it does continue to have more of a positive than a negative impact on the mental health of Canadians. That being said, it was interesting to find that some of the people who last poll said that it was kind of having a neutral impact on their life are now saying that it's having a negative impact. And again, we don't like to editorialize too much, but in our conversations, we kind of touched on the idea that it might be due to friends and loved ones feeling the impacts, and it in turn kind of being passed on to Canadians who are vaccinated. I just want to be clear on what that means. So we asked Canadians, how has a vaccine mandate impacted your mental health? The number of people who are saying it's positive has not moved. The number of people who said it was neutral has shifted to slightly more negative. So there's a little more of a binary. It's not really 3 choices anymore. It's mostly people have decided to get off the fence and it's either positive or negative for their mental health.
Thank you. So now we're going to look at things in a little bit more detail. And again, if anybody has any questions during any of this, feel free to throw your hand up or add something to the chat, and we will keep an eye on it. So as I mentioned, we have many, many questions in our survey, but one that we ask consistently is whether Canadians have been diagnosed with anxiety or depression prior to or since COVID-19 began. So, since COVID-19, we're seeing that 7% of Canadians have been diagnosed with an anxiety disorder and 7% have been diagnosed with depression. And 8% are saying a family member has been diagnosed with an anxiety disorder, and 8% are saying that a family member has been diagnosed with depression. So that has increased a significant amount since COVID began. So here we're looking at Canadians that we've found to be most likely to be diagnosed with anxiety and depression. And this hasn't changed very much over the last year, really. But we are seeing consistently that women are a bit more likely than men to be diagnosed with an anxiety disorder. Younger Canadians have been more likely to be diagnosed as well as those with children under 9 years old, Canadians who are unemployed, and frontline healthcare workers, which you'll be seeing a decent amount throughout this presentation. We also looked at Canadians most likely to be diagnosed with depression, and again, we're seeing younger Canadians and those between 18-34, 35-54, and then it starts to decrease after 55 years old, we found. And again, Canadians with children under 9 years old, women are more likely to be diagnosed than men. This is 29% versus 19% of men, and also Canadians who are unemployed. I'm gonna go through this a little bit quickly in the interest of time, but Michael, feel free to jump in at any time. And again, if anybody has any questions, please let me know. So we also want to understand how people are addressing their mental health challenges. And those who have received a disorder, almost 3/4 are receiving treatment, and prescription medication we found is the most commonly accessed.
Talk therapy is usually considered the best one, and it's unfortunate that it's maxing out at 30% to 22% if you're talking to your doctor. We also noticed, we do ask if people have access to an EAP or benefits, and there is a statistically significant difference between people who have access to benefits or not, suggesting, of course, that there are a number of people with diagnosis who are not accessing benefits, who are not able to access care, a gap. Sorry.
And this we touched on earlier. We wanted to ask what people, what Canadians, particularly those who have been diagnosed with a mental health illness or their loved ones, deemed to be the highest priorities in Canada, or deemed to what should be the highest priorities in Canada. And as we mentioned, COVID-19's impact on mental health has been, as well as ending the negative stigma of mental health, are the two most popular choices, as well as largely the two that were indicated to be the second highest priorities. So as you can see, we also included options such as suicide, mental health of healthcare workers, addictions and substances, mental health of seniors, etc. And again, as mentioned in our major findings, we asked what should be the most important area of research. So improving service provision and building support around individuals were the two most popular. And the second one is a little bit ambiguous. So in that we did mean understanding how factors such as income, housing, employment, etc. affect an individual's mental health, and making sure people in these situations are getting the mental health services that they need.
Brittany, just to interject here, in the interest of time, I know we want to be done by about 1:35 to leave time for questions at the end. This, though, was a fascinating piece for me, because we're constantly having conversations about setting agendas for priorities in mental health. And we regularly get the clinician voice in terms of this is what a clinician believes needs to happen, or a community organization voice. And we often get people with lived experience, but there might be one or two consulting on a project. Our goal here was to get a large volume, completely blind, in terms of they don't know what questions they're being asked, not literally blind, but a blind study of people with lived experience, asking them what their priorities were. And I think that has a lot of validity. I think asking individuals who don't know that they're going to be asked what their priorities are in mental health, because they are people with lived experience, has a lot of validity and is an important question that we should be asking. So we've been excited to share this with some policymakers from different provincial governments and federal governments who are making some policy decisions around this. And I think it's important that we keep these individuals as a primary area we focus. Sorry, a little bit of a sidetrack there.
No problem. I am going to start. I'm going a little bit quicker through these slides, but happy to answer any follow-up questions. So we touched on this before, levels of self-reported anxiety and depression. We look at these self-reported levels both before and since COVID-19. We have noted that there might be a little bit of recollection bias when people are thinking of their mental health prior to COVID-19, but we want to keep this question in for consistency's sake.
It's interesting that the recollection of your level of anxiety pre-COVID went from 5% pre-COVID at the start of this to 9%. And we do realize there's a recollection bias there. We keep it in for data consistency, but I don't think 9% of people had high anxiety. I think it's more accurate to say it's probably closer to 5%.
Really. So here's just a little bit more of an interesting breakdown. I'm not going to spend any time on this, but it is there if you'd like to have a closer look. We do look at the differences between provinces as well. We found that Quebec consistently has had the lowest levels of anxiety and depression since COVID-19. Recently, we found that Alberta has increased, as Michael mentioned earlier, and now has the highest levels of anxiety.
Quebec is always the lowest, always.
We touched on the Kessler 10 earlier. This is a little bit more detail for anybody who would like to look a little bit closer into that. As well as the healthcare sector crisis that we mentioned previously. We are doing some supplementary work on the healthcare sector. We are in the midst of it and also have some briefs done as well for anybody who would like some more information. Also, feel free to reach out. This is a general anxiety disorder screening test that was mentioned earlier. This and the PHQ-9 haven't moved significantly over the last couple of polls. As mentioned earlier, the ability to cope and the ability to handle stress have been something that we've been paying attention to. As you can see, it really hasn't moved significantly over the last couple of polls. The red over here is people saying that they're not handling it well. The blue over here is people who are saying that they are handling it well. So it's certainly something that we want to pay attention to. Okay. All right. Again, this was mentioned earlier. A quarter of Canadians are indicating that they're feeling the effects of their mental health symptoms on their ability to function. So
this is fascinating that it's been moving down since poll 6. And I'm curious to know once Omicron has hit us fully and the lockdowns, whether or not this will actually change. But what this is a positive story. What it basically means is fewer Canadians, as the pandemic has gone on, have indicated that their ability to function is taken away.
I mean, that might be a resilience story for Canadians. A new normal, I suppose. So we look at this in terms of disruptions to day-to-day life. And we did find that most people who are experiencing disruptions were experiencing it in their social life or leisure activities, followed by school or work, and closely after that, family or home responsibilities. And then we also wanted to look at, for people who were experiencing these disruptions, how long was it lasting? And we found that the average
days lost. These were the days that were off.
Yeah. Yes, sorry. The average was close to 3 days.
This is impairment, yeah.
So, yes, switch it around. Again, the average here was about 3 days. This is people who are experiencing low productivity because of their mental health symptoms. So this we touched on earlier, the inclusion of a suicide ideation question in our poll beginning in poll 6. So we broke it down to Canadians who are experiencing suicide ideation in the past year, as well as those who had planned a suicide attempt in the past year and those who had thought about suicide in the past 3 months. And as mentioned previously, there are certain groups that we need to continue paying attention to, including younger Canadians, the LGBTQ2S+ community, and frontline healthcare workers as well, and those who are already experiencing mental health challenges. These are a little bit of a breakdown of the some of the factors that are having primarily a negative effect on Canadians' mental health. The fear of contracting COVID didn't see much of an increase, as mentioned previously. The economic downturn is continuing to have a negative impact, particularly among those who have a fear of potential job loss. The impact of the daily news has, for many polls, been a negative factor on mental health. We are seeing that this is experiencing a decline. Not sure if people have just stopped looking at the daily news or if it's just having less of an impact. And as mentioned before, social isolation is continuing to be a leading stressor on mental health. So it will be interesting to see in our next poll what this impact this has had following lockdowns across the country with Omicron. This is a little bit more of a breakdown. In previous polls, supporting my child's needs in schoolwork was much higher, but as this poll was taken, with talk of children returning to school and it being during the holiday break, it didn't have the impact that we would have expected, but it was a timing situation.
There was a significant drop in the number of people who thought that they're supporting their children's needs in schoolwork was positive or negative. I think we saw a normalization as how we interpreted this. There was a normalization going on in terms of how parents were interacting with their kids, which we were experiencing because we'd been so long since there'd been a lockdown, and it was normalizing. We'll see if that continues with Omicron then hit us after that.
Again, a few of the other factors were economic downturn, recent job loss, possibility of a family member losing their job. Again, this hasn't changed a whole lot overall. It's increased by just a couple of percentages since poll 9. This we already spoke about, but there's also some information on the impact of social media, entertainment, reading books, going outside. Going outside has, across the board, been one of the most positive influences on mental health. We can see it peaked in poll 5, which I'm not sure. That was around springtime, I believe, so which makes sense. It's kind of balanced out just like everything else. Confidence and ability to recover from challenges.
Resiliency question.
So this is always an interesting question. I think it says a lot about the resiliency of Canadians. It hasn't moved a whole lot in the past couple of polls, but it is good that it's staying relatively stable. We certainly did see a bit of a drop after poll 6, though.
This is an important indicator. If Canadians are feeling resilient, they're likely to bounce back.
Yes, this will be.
And luckily, the number of people who feel resilient is not going down. It's remained stable.
This will be important in the post-COVID-19 recovery period. Hopefulness question was an interesting one that we added just a couple of polls ago, particularly the question, I am hopeful about my future. This was a big one for us last poll. Between poll 8 and poll 9, it jumped majorly, 13%, and since then it has remained relatively stable, which is good to see, particularly with the new variant. So this will be an interesting one to keep an eye on next poll as well. This one we already touched on. Canadians who have not yet received a booster shot, over half of them are planning to get one. We also touch on this slide a little bit about children and those who have or will not be receiving a COVID-19 vaccination.
It's a bit of a control question because this doesn't directly impact mental health, but we wanted to understand if there was differences between these groups on the mental health indicators, which is something we've been following for quite some time.
Mm-hmm. And as for eligible Canadians who have received at least a first dose, we don't expect these numbers to change a whole lot. It's a point of interest, but I think at a certain point, we expect them to stay relatively stagnant. This one we touched on again as well. This was the proof of vaccine mandate. This is what we were talking about in poll 9. Net positive has remained relatively stable. Net negative has increased slightly, and no impact has gone down a little bit. So we are considering the fact that those who are saying that it's having no impact are now potentially saying that it is having a little bit of an impact. Again, as mentioned, concern over the continuing threat of COVID-19 has increased slightly, only slightly this poll, less than we expected with the Omicron variant. Another thing that we're interested in keeping an eye on in the coming polls. And once again, more look at the Omicron variant. Once again, really interested to see what comes in the next little while, because our poll 11 will be coming out within the next month and a half-ish. So finally, we like to look at mental health supports. And we have found consistently that 1/5 of Canadians are accessing mental health supports. And this has increased significantly since COVID-19 began.
It's always generally between 11 and 13% who said they did it before COVID, and it's generally between 20 to 22% since. That's
one thing that we like to keep an eye on is the option, no, I needed mental health supports, but I did not access any. So this has remained relatively stable, but it's still, of course, higher than we would like to see. This is a relatively new question for us. We found, we've been looking at post-secondary mental health, and we wanted to find out whether or not students were more likely to access mental health supports on campus or off campus. And we have found that not most, but a higher percentage are accessing mental health support off campus. And our final 2 questions are about satisfaction with support received, and also reasons for those who aren't accessing support, who believe that they need it, and why they aren't doing it.
This is a comparative slide before and after since COVID too.
So I'm going to switch in between these two for both sides of it. So we found that 65% of respondents are saying that prior to COVID-19, they were satisfied with the support that they had received. That hasn't changed very much since COVID-19. We also found that the primary reason for people who felt they needed support but weren't accessing it prior to COVID-19 was that they prefer to manage it themselves, followed by they couldn't afford to pay. And once again, those are still the top 2 reasons. They have kind of leveled out to the same amount of the same percentage, but that again hasn't changed a whole lot. We were interested when we first started running this to find that concern of COVID-19 wasn't a huge factor in reasons for not accessing. And that brings us to the end of the report. So we have a few minutes if anybody has any questions or would like some more information about anything in particular.
Brittany, while we're waiting for any comments that might want to come in, I would ask you just to summarize what surprised you the most when you did this.
I think we spoke a lot about the impact of Omicron on Canadians, and it definitely surprised me to find that it didn't seem to have a huge impact on levels of general high reported anxiety, but also levels of people who were we're fearful of getting COVID. And speaking about that question, I am hopeful for my future. It is positive, but also interesting to see that that didn't move either, especially with this new variant and so much news around it and so much potential change that could come with it.
Interesting. All right, is there any questions?
Great. Well, I'm going to post our the link to this poll in the comments, as well as our other reports.
We'll be collecting our next sample from mid-February. So in about 2 weeks, we'll be collecting poll 11, which we'll probably report on in the first 2 weeks of March. Looking at the and I think what's really fascinating for me is we just the way our timing worked out, we missed the spike when Omicron was really going to 10,000 cases a day in Ontario, 50,000 cases across the country. I know others have covered it, and I know it was shocking for a lot. What we see when we look at our data is that the actual indicators on mental health weren't significantly moving right up until Christmas. Now, we don't know exactly what happened in January. We are using clinical screeners. We are using clinical tests in addition to self-rated scales. And we will be super interested to find out what happens in February when most of this is on the downslide in terms of the number of cases. The lockdowns have been lifted for most parts across the country. And that'll be a really interesting find for us, because it's important that we keep our eye on, are these, flash in the pan experiences, or do people really need help? And I think that's something we'll be looking for in February to see if it's basically returned to where it was or stays the same, or if it's actually generated any sort of significant perpetuating impact on mental health. All right, well, thanks everyone for your time. Thank you, Brittany, for going through that. If you have any questions, you can go to that website and you can find our email addresses, send us questions. We're always happy to answer them. We have a tremendous amount of data about what's happening with Canadians, and we're always happy to speak about it. Thanks so much for your time, everyone.